myelofibrosis represents a specific topic that could be talked for another 3+ hours, if not days. But the most important message for myelofibrosis is that in 2025, we have 4 approved JAK inhibitors. They are listed here for patients that would need therapy directed for the spleen and symptoms, and for specific cytopenias, anemia with momelotinib, and thrombocytopenia or low platelets with pacritinib. There are unfortunately no other approved therapies for patients with myelofibrosis needed treatments for the spleen and symptoms or those cytopenias mentioned. However, there is a lot of clinical trials ongoing for either newly diagnosed patients or patients that would fail already established therapies in the next lines. Some of them are showing high promised informations or data. For example, the new launching BET inhibitor studies, something called Export or Selinexor that has been having a lot of data already presented from across the studies by now, PIM kinase inhibitor or novusertib, TGF-beta traps, and then specific inhibitors, as I mentioned, for calreticulin, but also JAK2 as a new generations that would be hopefully superior to currently approved ruxolitinib, fedratinib, pacritinib, or momelotinib. So for myelofibrosis, would be encouraged to monitor response if the therapy is already chosen as a standard of care, frequently reassess the disease, and then seek a second opinion if a new therapy is needed, particularly for the intention of getting a better next line options and more longer durable steps, because in these diseases, it is rare. It is a little harder to develop the drugs because it's a very broad experience and presentations when the disease progressing. And we have not been able to exactly define who would benefit from what approach. Therefore, there is a broad variety of clinical trials focused on different aspects of the disease progression, whether we need to more control splenomegaly or enlarged spleen symptoms or the blood counts, and what would benefit the patients the most and the longest for hopefully offering either the ultimate cure or the longest disease control with the minimum, if no consequences, and the best tolerance. And I think I would finish up with this sense that please do seek for a clinical trials whenever possible. This field is moving very rapidly. The last 2 years have been almost groundbreaking discoveries, and then moving into clinic quickly. So we would like to get patients positive messages as well as their well-being, and then a nominal clinical trial so they could benefit from ongoing research as long as possible and as durable as we can deliver. Thank you so very much.